I'm Dr. Barker. This is Dr. Sprinkle. We're here with Mr. Dawson here, and he's here for a tongue tie release. I'm an osteopathic physician. Dr. Sprinkle is a dentist, and we're going to be kind of working together to do a tongue and lip tie release for Dawson. So Dawson was initially referred to me for neck tightness and problems with his cranial bone motion, and after I met with him, I diagnosed him with a tongue tie and a lip tie. He does have a lot of neck restriction in his upper cervicals. Even after I treat them and get them back into alignment, it doesn't seem to hold. And so each time I'm treating him, I'm having to go back and put his neck back into alignment. He does have a lot of tenderness when I'm working on his neck and in his head. Things that just a light palpation is tender for him. I also noted that he had some issues with sleep, so he snored and mouth breathed, which are common things found in patients with tongue tie. So we did finally get him into a facility to do a sleep study, which showed mild obstructive sleep apnea, which means he was stopping breathing through the night, which stops him from getting into the deep sleep and stops the normal sleep pattern. So Dr. Sprinkle can kind of talk on what he has found from a dental perspective.
From a dental perspective, if your tongue can't get up into your palate properly, if the frenum, the little attachment under your tongue, is too tight, you can't get your tongue up into your palate. And that sucking and swallowing motion that you develop in utero, and then obviously follows through in life, the tongue needs to get up into the palate, press against the palate, and this creates pressure that causes the palate to get wide and give that big, broad Farrah Fawcett type smile. If the tongue can't get up there, you're more restricting the palate, you're more prone to crooked teeth, you're more prone to have an airway issue that causes you to breathe through your mouth, which can cause you to have irritation of your tonsils and adenoids, which then swell and really just magnify the airway problems. And so what we're looking at today is to see if we can release his tongue by doing a partial frenuloplasty and genioglossectomy, and see how Dr. Barker senses the changes that go through that. But he's also got tight labial frenum. This is called the mandibular labial ligament down here, and that's relatively tight. He also has, as you can see from here, he's got crowded anterior teeth, and he's got a fairly thick frenum, maxillary frenum that goes through here. He also has some tight buccal frenum. Then we're going to do some releasing with those also. But we'll do those in steps. We'll do the tongue first to see what kind of release we get from that before we do any more anesthetic that might change his cranial motion from doing those. So we're just trying to take it step by step so that we kind of get a grade on how he's improving as far as his cranial function goes.
So the tongue muscles are actually multiple different attachments, and so the tongue muscles attach to bone, to 3 different bones. One is to the jawbone, the second one is to the hyoid, which is a U-shaped bone in the front of the neck, and the third is to the base of the skull. So every time you're moving your tongue thousands of times throughout the day, it's causing this abnormal tension on all of these bones, which causes a typical forward head posture, causes that tightness, forward shoulders, and the fascia, which is the connective tissue from the tongue, actually has connections all the way down to the foot. So it can cause so much fascial strain. So one of the things we're going to do is to see what tethered oral tissues are connected to what fascial strains that we're palpating in Dawson's body to help guide what we're going to release today.
And this just shows you the fascia from the tongue.
Wow.
Goes through the airway, through the diaphragm, through the muscles of the low back, through the groin area, through the back of the legs, the adductor muscles, all the way to the bottom of your feet. And when you have an airway restriction, usually this fascia tightens and brings the shoulders forward, the head posture forward. It can cause scoliosis, all different types of things. And if we can get all this to release, this relaxes, pain changes, posture changes, sleep habits change. I mean, it's really quite remarkable. The autonomic nervous system just calms down once you can get that airway open.
So do you want to test out some of these tethered oral tissues now?
Yeah. Okay, so here we're gonna go.
So that is related to tension right at the base of the skull.
Okay. And what we're doing is we're just pulling his lip out and literally just kind of strumming.
It's also pulling at his sternum.
Okay. You're gonna go back here on the lateral side of his mandible. How about that? Feel much there?
No.
And then over here.
No. Are you feeling anything that feels tight?
It's not too bad, no. Okay, and up here, you go through the maxillary phrenum.
Yeah, that's just pulling right on his mastoid.
Okay.
And that's pulling right in the midline,
Okay.
right into C2.
Okay. And up here, he's got a fairly tight little buckle.
Yeah. That one's also pulling into the left mastoid.
And then over here on the right side.
And that one I do feel some tension increasing as well.
Okay. Hold your tongue up. Feel that? Okay. Tongue up. Okay, hold your tongue right up here for me. That'll go. Good job. Open your tongue up.
Well, sometimes you just
You're doing great, my friend.
yeah, that made an incremental improvement here as well. Does this feel better in your neck? Less painful when I push on it? Yeah, I wonder how much of what.
And this is called the mandibular labial tendon. Dr. Mariano Roccabato. Did you ever read that article, Dr. Barker?
I'm not sure.
Roccabato's talked about all the things that this affected.
I don't think I did read that one. Representative.
I'll have to send it to you.
But well, the outcome was good for her, I assume.
Yeah, yeah. Well, the interesting thing was I asked her what was the most surprising benefit. And she said, well, that was when I pulled out of your driveway. And I went, what do you mean? When I left after you did the procedure, I backed out of the driveway and realized I had turned my head to the left. And I hadn't been able to do that in over 30 years.
Wow.
And that's when I realized there was something really important going on here.
And that was how many years ago?
That was almost 3 years ago.
And then you did the Dr. Zogby's course after that?
Yeah. Well, I did a couple more patients. I had a lady that had been a chronic pain patient since she was 8 years old. She was a professional viola player. She had a very curved upper back, almost hyperkyphotic, if not hyperkyphotic. And she found us on the internet because she had a friend that had a release. He lived out of state, and she got all this benefit from it. And so she wanted this patient to see if she had a tongue tie, so she found me on the internet. And we did it, and she stood an inch taller as soon as we finished the procedure. Okay, now, see if this right side is any better. I can feel a little bit of tension in there.
Yeah, that did improve it. This neck's a lot softer. I think his like C2, C3, I think is gonna get some release with the uppers.
Yeah.
Yeah, feels good so far.
You can push that back. If it's in your way. Let me hold this like that.
Yeah.
You okay? Kind of blocking your nose, I know.
Do I start doing his massage whatever's today, or?
He'll go.
Yeah, go,
I
yeah.
think he's got a handout with us.
Okay. Excellent. Colleen and sent me some stuff I need to go over.
Your post exercises. Yeah, those. She's got stuff to start today.
She does? Okay, good. I need to look at it then.
I think we got the same sheet as her, too, and I'll
Okay.
give it to you.
Excellent, thank you. One less thing to go dig up.
Yeah. You okay?
Just keep thinking about that ice cream, Dawson. It's gonna be so yummy.
I don't know if you are, but I sure am.
Now Dr. Sprinkle's gonna have to go get a smoothie on his lunch break.
My lunch break's been rescheduled.
It's crazy how much is in there, deep in there, like muscles.
Yeah, I'm just trying to loosen this up all the way back here to this area back here.
Okay, Dawson?
All right.
Not the other scissors or not?
We have a feel of that.
Yeah, the toe cutter. Symmetric, all the tissues around the posterior neck are soft. Shoulders I can compress down into the table.